Good morning, everyone. Today what we're going to do is talk about taking vital signs. Some point in your career, you're probably going to have to be able to take vital signs on one of your patients that runs into maybe complications from contrast, or they're just not feeling well, and the radiologist requests that you take vital signs on them. So today what we're going to talk about is temperature. You're going to need a thermometer, an alcohol prep pad. We're also going to talk about taking a pulse and a blood pressure. So you'll need a watch with a second hand. You'll need a blood pressure cuff and a stethoscope and a pair of gloves. So the first thing we're going to do is take a temperature. What you're going to do, get your patient. You're going to ask them for their two patient identifiers, name and birth date. Okay. You're going to wash your hands or Purell, whichever one is closest, and then you're going to put on your gloves. Okay. My gloves on. You're going to take your thermometer and your alcohol prep pad. You're going to want to clean your thermometer, and you're going to clean it from the tip that goes in the mouth, the end that goes in the mouth, the tip, and clean it down. Okay. And then lots of times places have thermometer sleeves. So you want to stick it in the sleeve, stick it all the way in, and then what you do is pull the ends off. Turn the thermometer on, and you're going to put it in the patient's mouth. Don't put it right in the middle. You're going to put it off to the side. And when you put it in their mouth, you're going to want them to hold it for you. So put it in there. It will beep when it's ready, and it usually takes about 10 seconds or so. Okay, I have the temperature. What you're going to do then is you're going to take that temperature and you're going to document it. Okay. That is taking a temperature. So then what we're going to do is go on to taking a pulse. You can take a pulse, a carotid pulse, or you can take a radial pulse. We're going to cover the carotid pulse to start with. I'm going to remove my gloves because it'll be easier to feel. So what you can do this on yourself. So if you raise your chin, okay, follow your chin, the midline down, you can feel your windpipe, you're right down there. And if you go to the left or the right, you can feel a muscle. You want to be halfway between that windpipe and that muscle for that pulse, okay? You want to use your index finger and your middle finger and gently put your fingers there. You may have to feel around just a little bit to find it. Everybody's just a little bit different. Once you find that pulse, what you're going to do is get your watch, okay? You're going to count that pulse for 30 seconds. And then after the 30 seconds is up, you're going to multiply that times 2, and that will give you your pulse rate. The other way to take a pulse is doing a radial pulse. If you have your patient's arm just nice and relaxed, okay, and you can feel this bone here, and if you slide medial, you will feel a groove there. That's where you want to take the radial pulse. Once again, your index finger and your middle finger, nice and gentle. If you don't feel it, you may be pushing a little too hard. And again, once you feel the pulse, you're going to need your watch to count it. So count it for 30 seconds and then multiply it times 2, and that gives you your pulse rate. While you're doing this, you're going to want to count the respirations as well. So most of the time people just leave their fingers here after the 30 seconds, and then they start to watch the chest rise or fall. And they count those respirations for 30 seconds. And then multiply those times 2, and that gives you your respirations per minute. Okay, now what we're going to do is take the blood pressure. And you're going to ask the patient their name and the birth date.
John Smith, 2/23/85.
Okay, and that matches the order. You always want to make sure you ask the 2 patient identifiers before you do anything on the patient. So look at your blood pressure cuff. Here is the arrow that says artery. You're going to want to place that arrow over the artery, which is approximately here. This goes over the arm up here, and you're going to wrap it around snugly. You don't want it real tight, okay? Then what you're going to do is you're going to get your stethoscope. And if you look at your stethoscope, you can see that the earpieces are angled. You want those angles going into your ears, going forward. So I'm going to put those into my ears. I'm going to place the stethoscope over the artery, just right here. You want to use your finger to hold it. Do not use your thumb, because your thumb has a pulse and you'll be taking your own pulse instead of the patient's. The next thing you're going to do is tighten up the valve. You want to close it because you want air to go in the blood pressure cuff. So when you pump it up, if the air is not staying in the blood pressure cuff, then you do not have the valve closed. You're going to pump the blood pressure cuff up to about 180 or 200, and then take the valve, slightly loosen it so the air leaks out very slowly. Okay. Listen carefully. You're going to start to hear a heartbeat. That will be your systolic. You're hearing it. And then the last beat that you hear will be your diastolic pressure. Go ahead and let the air out the rest of the way, and you can take this off of your patient then. And that is how you take a blood pressure.